Hip arthritis is a common condition where the cartilage material in the hip joint, which allows the joint to move smoothly, becomes damaged. This can lead to pain and stiffness, and can mean that it may be difficult to complete everyday activities. In severe cases of hip arthritis, and where more conservative treatments such as exercise, physical therapy, and pain relief haven't improved symptoms, it may be necessary to have surgery to replace the hip joint. This is called a total hip replacement and involves replacing both the ball and socket parts of the joint with artificial components. Total hip replacement surgery is very successful for the majority of people. However, more than 10% of patients still have pain in the operated hip 1 year after surgery, and more than 6% are dissatisfied with their surgery. Many of these people will require further tests or treatment, and as over 100,000 total hip replacements are completed every year in the UK, even a small improvement in the way the surgery is completed will have a positive impact on thousands of patients and could save millions of pounds for the NHS, along with having wider benefits for society. During a total hip replacement, in order to reach the hip joint, surgeons cut through tendons, which attach muscles to bone. Tendons provide stability and strength during daily activities. The most common way to complete the surgery involves cutting 3 tendons at the back of the hip joint, which are then repaired once the artificial hip is in place. This is called the posterior approach. It allows a clear view of the hip joint, so the artificial ball and socket can be correctly positioned. Modified versions of the posterior approach have been developed. The piriformis sparing posterior approach only cuts 2 tendons, and the spare piriformis and internus repair externus, which is known as the spare approach, cuts only 1 tendon, and was developed by Professor Timperley at the Royal Devon University Healthcare NHS Foundation Trust. The approaches that cut fewer tendons aim to reduce recovery time, improve rehabilitation, and improve patient satisfaction. However, cutting fewer tendons can limit the visibility and access to the hip joint, which can make positioning the socket of the artificial hip more challenging. Robotic-assisted surgery allows surgeons to position the artificial hip components very accurately during the operation, so may help with the reduced visibility of the joint when fewer tendons are cut. The Royal Devon University Healthcare NHS Foundation Trust is using the latest robotic system for total hip replacements, and this provides the opportunity to investigate whether cutting fewer tendons during total hip replacements can improve rehabilitation. The HIP Surgical Techniques to Enhance Rehabilitation, or HIPSTER randomised controlled trial, will compare the outcome of total hip replacements completed using the standard posterior approach, where 3 tendons are cut, with the modified versions, where either 2 tendons or only 1 are cut. All surgery will use robotic assistance, so the only difference between groups in the trial will be the number of tendons that are cut. As part of the trial, we will measure muscle damage and inflammation using blood tests, patient pain, disability and satisfaction using questionnaires, and activity monitors to measure daily activities like walking and sleeping, which previous patients have highlighted was important to them when they had their total hip replacement. The trial is being completed by the Exeter Hip Unit of the Royal Devon University Healthcare NHS Foundation Trust, in collaboration with the Department of Engineering at the University of Exeter and the Exeter Clinical Trials Unit. It is funded by the Efficacy and Mechanism Evaluation Programme, which is a partnership between the Medical Research Council and the National Institute of Health Research.